For decades, we've been told that choking is something that happens to others, that it's rare, that help will always be nearby. But the reality is starkly different, especially for those over 70. Every year, thousands of seniors find themselves in a terrifying situation. Alone, choking, with no one to call for help, and precious seconds ticking away. Today, I want to share with you the life-saving techniques that could mean the difference between panic and survival when you're facing this emergency by yourself. The statistics are sobering. Adults over 70 are significantly more likely to experience choking incidents than younger populations. Changes in swallowing muscles, decreased saliva production, dental issues, and certain medications all contribute to this increased risk. But here's what many people don't realize. Most choking deaths in seniors occur when they're alone, often during meals or when taking medications. The conventional advice of calling for help becomes useless when there's no one around to hear your distress. What makes choking particularly dangerous for seniors isn't just the physical obstruction itself. As we age, our panic response can become more intense, leading to rapid oxygen depletion and loss of consciousness more quickly than in younger adults. The window for effective self-rescue narrows considerably. Additionally, many seniors have underlying health conditions that make them more vulnerable to the cardiovascular stress that choking creates. The first and most critical step when you realize you're choking and alone is to immediately attempt the self-administered Heimlich maneuver using a chair. This technique has saved countless lives and can be performed even when you're experiencing panic. Find a sturdy chair with a firm back, preferably one without wheels. Position yourself so that the top edge of the chair back is just below your rib cage, right at the spot where your ribs meet in the center. This positioning is crucial because it targets the same area that emergency responders would target if they were performing the maneuver on you. Grip the sides of the chair back firmly with both hands. Now, thrust yourself forward and downward onto the chair back with quick, forceful movements. The pressure should be directed upward into your diaphragm. Don't be gentle with yourself in this moment. The force needs to be significant enough to create the pressure wave that will dislodge the obstruction. Each thrust should be deliberate and powerful, similar to what you would experience if someone were performing the Heimlich maneuver on you from behind. If the chair method doesn't work immediately, don't panic and continue trying, but also prepare to use a second technique. The fist method can be equally effective and doesn't require any furniture. Make a fist with your dominant hand and place the thumb side against your upper abdomen, just below the rib cage and above the navel. Cover your fist with your other hand and press hard into your upper abdomen with quick upward thrusts. The motion should be similar to trying to lift something heavy up and into your chest cavity. The key to success with both these methods is the angle and force of the thrusts. Many people make the mistake of pushing straight back or not using enough force because they're afraid of hurting themselves. But in a choking emergency, bruised ribs or abdominal discomfort is infinitely preferable to oxygen deprivation. The goal is to create sudden, intense pressure that mimics a powerful cough from inside your body. If you're in a public place or have access to other furniture, a table edge can also be life-saving. Find a table that's about waist height and lean forward so that the edge presses into your upper abdomen just below the rib cage. Use your body weight to create firm, upward pressure as you lean into the table edge. Rock forward forcefully and repeatedly. This method can be particularly effective because you can use gravity to help generate the necessary force. During any of these techniques, it's important to understand what's happening in your throat and airway. The obstruction is most likely lodged in your windpipe just below your vocal cords. The pressure you're creating is designed to force air up through your windpipe with enough power to push the obstruction out, similar to an extremely forceful cough. Some people find that alternating between the self-Heimlich techniques and attempting to cough can be effective, as coughing uses your body's natural expulsion mechanism. If the obstruction is only partial and you can still make some sounds or get small amounts of air, try leaning forward and coughing as forcefully as possible while gravity helps. Sometimes a combination of gravity and your natural cough reflex can clear a partial obstruction before it becomes complete. However, don't spend too much time on gentle coughing if the obstruction is severe. Move quickly to the more aggressive self-rescue techniques. One crucial detail that many people overlook is the importance of staying upright during choking. Lying down can actually make the situation worse by allowing the obstruction to settle deeper into the airway. If you become dizzy or feel like you might faint, lean against a wall or sturdy furniture, but try to remain standing or at least sitting upright. This positioning also makes the self-administered techniques more effective. For seniors who have mobility limitations or use assistive devices, these techniques can still be adapted. If you use a walker, the top bar can serve as a pressure point for a modified Heimlich maneuver. Wheelchair users can position themselves at a table edge or use the arms of their wheelchair in a similar fashion. The key is to find any firm edge or surface that can be pressed into the upper abdomen with sufficient force. After successfully clearing the obstruction, your immediate instinct might be to feel relief and continue with your day, but this can be a dangerous mistake. Choking incidents can cause throat irritation, small tears in the airway, or aspiration of small particles into the lungs. Even if you feel fine immediately afterward, it's important to seek medical attention within a few hours. Some complications from choking don't appear immediately, but can become serious if left untreated. Signs that require immediate medical attention after a choking incident include persistent cough, difficulty swallowing, throat pain that worsens rather than improves, voice changes, or any breathing difficulties. Some people experience what's called post-obstruction pulmonary edema, where fluid accumulates in the lungs hours after the incident. While this is relatively rare, it's potentially serious and requires prompt treatment. Prevention strategies become even more important as we age, and many effective techniques are surprisingly simple. Cutting food into smaller pieces isn't just about convenience. For seniors, it's a critical safety measure. Food pieces should be no larger than a half-inch in any dimension. This is particularly important for meat, hard fruits, and vegetables, and any foods with tough textures. The speed at which you eat plays a significant role in choking risk. Many seniors, especially those living alone, tend to eat quickly or while distracted by television or reading. Eating slowly and chewing thoroughly isn't just good for digestion. It's essential for airway safety. Each bite should be chewed until the food is completely broken down, which typically requires 20 to 30 chews for most foods. Saliva production decreases with age, and many medications further reduce saliva, creating a dry mouth that makes swallowing more difficult. Taking small sips of liquid between bites helps maintain adequate moisture for safe swallowing. However, avoid drinking large amounts during meals, as this can actually wash food down before it's properly chewed, potentially creating larger pieces that are more likely to cause obstruction. Certain foods present particular risks for seniors and should either be avoided or consumed with extreme caution. Whole grapes, cherry tomatoes, large pieces of meat, hard candies, nuts, and popcorn top the list of high-risk foods. If you choose to eat these foods, modify their presentation. Cut grapes and cherry tomatoes in half, choose ground or finely chopped meat, avoid hard candies altogether, and opt for softer snack alternatives. Medication management also plays a crucial role in choking prevention. Many seniors take multiple pills daily, and pill-taking technique becomes increasingly important with age. Pills should be taken one at a time with adequate water, and you should remain upright for several minutes after swallowing medications. Some seniors find that using a pill crusher for appropriate medications, checking with their pharmacist first, makes swallowing safer. The position you eat in affects your swallowing safety significantly. Always eat sitting upright, never lying down or reclining in a chair. If you have mobility issues that make sitting upright difficult, use pillows or cushions to maintain as upright a position as possible. The goal is to allow gravity to assist in moving food down your throat and into your stomach, rather than having it potentially move toward your airway. Environmental factors in your home can also support choking prevention and emergency response. Keep a sturdy chair in your dining area that could be used for self-administered Heimlich if needed. Some seniors place emergency instruction cards in visible locations as reminders of the techniques. Having a phone easily accessible during meals isn't just for social connection. It ensures you can call for help if self-rescue techniques aren't successful. Understanding the signs of swallowing difficulties can help prevent choking incidents before they occur. These warning signs include frequent coughing during meals, the feeling that food is sticking in your throat, changes in your voice after eating, or the need to swallow multiple times to clear food. If you experience any of these symptoms regularly, consult with your doctor about a swallowing evaluation. For those with dentures, proper fit and maintenance become safety issues as well as comfort concerns. Ill-fitting dentures can affect chewing efficiency and create sharp edges that may cause you to swallow larger pieces of food. Regular dental checkups ensure that dentures continue to fit properly and function effectively for safe eating. The psychological impact of a choking incident can be significant, especially for seniors living alone. Many people develop anxiety around eating after experiencing choking, which can lead to poor nutrition and social isolation. If you've had a choking incident, consider discussing it with your healthcare provider. Sometimes simple modifications to diet texture or eating habits can restore confidence while maintaining safety. Hydration status affects swallowing safety more than many people realize. Dehydration, which is common among seniors, makes saliva thicker and reduces the natural lubrication needed for safe swallowing. Maintaining adequate fluid intake throughout the day, not just during meals, supports safer eating. However, be mindful that excessive fluid restriction due to certain medical conditions should always be balanced with swallowing safety under medical guidance. Some seniors benefit from learning about texture modification techniques that maintain nutrition while reducing choking risk. This doesn't mean switching to a completely soft diet unless medically necessary, but rather learning to prepare foods in ways that are easier to chew and swallow. Techniques like braising meats until tender, roasting vegetables until soft, and choosing naturally softer fruit varieties can maintain eating pleasure while improving safety. The role of regular exercise in choking prevention might not be immediately obvious, but maintaining good posture and respiratory muscle strength supports safer swallowing. Simple exercises that strengthen the muscles used in swallowing and breathing can be incorporated into daily routines. Even basic head and neck movements and deep breathing exercises can help maintain the muscle coordination needed for safe eating. Technology can also play a supportive role in choking prevention and emergency response. Medical alert systems that can detect falls might also be triggered by the distress of a choking incident. Some systems include two-way communication that allows monitoring services to hear if you're in distress. While technology shouldn't replace learning self-rescue techniques, it can provide an additional safety net. Regular self-assessment of your choking risk factors helps you stay aware of changes that might increase your vulnerability. Factors like new medications, changes in dental health, recent weight loss that might affect denture fit, or increasing difficulty with coordination all warrant attention and possibly discussion with healthcare providers. The importance of informing family members, friends, or neighbors about your increased choking risk, and the techniques you've learned cannot be overstated. Even if you're often alone, having others aware of the signs of choking and basic response techniques means that help will be more effective when others are present. Finally, practice of self-rescue techniques done carefully and gently can build confidence and muscle memory that could prove life-saving. Obviously, don't practice with actual obstructions, but familiarizing yourself with the positions and movements while you're calm and thinking clearly makes them more likely to be effective in an emergency situation. Remember, choking incidents are survivable, especially when you're prepared with the right knowledge and techniques. Age doesn't make you helpless in the face of this emergency. With proper preparation, prevention strategies, and confidence in self-rescue techniques, you can maintain both safety and independence in your eating habits. The key is not to live in fear of choking, but to live with the knowledge and preparation that put you in control of your response to this potential emergency.